welcome back everyone. I am Dr. Khalid Hassan, Associate Professor of Clinical Pharmacology, Drug Therapy and Clinical Research. In this session today we are going to speak about anti-seizure drugs, which is known also as anti-epileptic drugs. Okay, as you can see from the list here, we have 28 medications, 28 drugs used to treat epilepsy or seizures. On the right and left side, we have two columns here. We have the blue color represent the generic name, and the black color represent the brand name. So we are going to maybe mention these names for maybe briefly, and then we go to in details for everyone. Okay, anti-epileptic drugs, list number one, generic and brand name acetazolamide, and generic name Diamox. Then we have brivaracetam, carbamazepine, clobazepam, clonazepam, chlorazepate, diazepam, divaloproxodium, esleracarbazine, ethosuximide, felbamate, gabapentin, leucosamide, lamotrigine. Lamotrigine brand name Lamictal. For example, we have one is that important here, diazepam, Valium. So from this list here, we need to remember all these generic name, brand name. We will learn this brand name by practice. Okay, the second list on the right, we have levetiracetam, the brand name Kepra, levetiracetam. Lorazepam belong to the benzodiazepine, brand name Ativan. Oxcarbazane, birambanil, phenobarbital, phenytoin, pregabalin, brimidone, refinamide, tiagabine, topiramide or topiramate, valproic acid, fegabatrin, zonisamide. So a list of medication, as you can see here, we have list 1 and anti-epileptic list 1 and list 2. The total number of these medication, 28 medications. Okay, speaking about the definition of seizure, seizure may be defined as a sudden, uncontrolled burst of electrical activity in the brain. This abnormal activity disrupts the normal message between brain cells. This will lead to the temporary change in behavior, movement, and feeling and level of consciousness. So this is the definition of seizure. For this reason here, if the patient suffers from seizure, when the patient suffers from seizures, we intend to use anti-epileptic drugs. So anti-epileptic drugs are primarily used to prevent or control epilepsy, which is known as seizures. So here we have seizures. Okay, here's the definition for seizure. Okay, moving to the causes of epilepsy according to the World Health Organization 2024 recent published articles. Epilepsy is not contagious disease. This is an important one. Epilepsy, 50% of cases of epilepsy unknown reason. Underlying disease, some known reason could be related to the structural, genetic, infectious disease, metabolic disease, or immune disease. So briefly here, causes of epilepsy according to the WHO 2024. Number one, they stated that epilepsy is not contagious disease. Number two, 50% of epilepsy unknown causes. Number three, we have some cases belong to the another 50 could be related to the structural disease, genetic, infectious disease, metabolic disease, or immune disease. Example for the underlying causes could be related to the brain damage, congenital abnormalities, genetic conditions, stroke, brain infection, genetic syndrome, or brain tumor. As you can see from this key point here, takeaway point, seizures consider like sudden, uncontrolled movement, electrical activity, disrupted communication, and temporary change. So we have some key points happened in seizure. Could be one of them, could be all of them. Number one, sudden uncontrolled, sudden and uncontrolled. Number two, electrical activity. Then we have disrupted communication. Then we have temporary change. So regarding the what happened here for temporary change, as you can see, the temporary change, regarding the temporary change happened during seizures. Regarding the temporary change happened during seizures, you can see here the patient may suffer from changes in behavior, acting confused or staring blankly, abnormal movement like jerking of limbs or stiffening, altered sensation, strange smell, taste, or feelings, change in unconsciousness, such as losing awareness, losing feeling, or feeling detached. A little bit of detail about the example. The patient may suffer from brain damage, for example, here due to the prenatal or perinatal causes. Okay, prenatal or perinatal causes due to the decrease of oxygen supply or trauma during birth or low birth weight. Could be related to the congenital abnormality or genetic conditions associated with the brain malformations. If the patient suffers from severe head injuries, if the patient suffers from stroke due to the restrict amount of oxygen to the brain, infections, if you have brain infections such as meningitis, encephalitis, or neurocytocirrhosis, cirrhosis, certain genetic disorders or syndrome, and brain tumor. Okay, so in this link here, we can click on this link and maybe review a list of medications. We can do it with you together, me and you together. So we can look on the list here. Medication for epilepsy available on drugs.com. You can see the brand name and generic name. This is a generic name for the medication. You can move here and select the brand name, or you can select both of them, generic and the brand name. I will maybe keep it like generic name. We have levetiracetam, lamotrigine, carbamazepine, gabapentin, clobazam, defalobrox, rofinamide, phenytoin, topiramide, clonazepam, oxcarbazane, valproic acid, pregabalin, locozamide, acetazolamide, felbamate, brimidone, bifarcitam, lorazepam, bramabanel, diazepam, eslicarbazine, phosphonotoin, phenobarbital, tiagabin, fegabatrin, sonamide, chlorazepate, ethosuximide. So we have list of medication here, and they give you the most popular one now. If you like to look on the brand at generic, for example, here filter. Okay, they give you the read more, so they give you the list of medication there. So I will stop here. I'm not going to maybe expand this one here, because so we have the link here for drugs.com. You can go for more details. Okay, prevention, what they said there, it's very important things to mention that 25% of epilepsy cases are potentially preventable. So that means if you follow the advice, if you follow the instruction, the guidelines, we have, for example, 25% of epileptic patients will not be suffering from epilepsy. So if you have 100 patients suffer from epilepsy, if we have 100 patients suffer from epilepsy, What that mean? If this 100 patients, for example, they follow the instruction for prevention, this will lead to the only 75% will suffer from epilepsy. That means we prevent 25% from maybe suffer from epilepsy if we follow the instruction from the WHO. Okay, so I will bring this one here and to read the information about this one before we start. This is World Health Organization. If you scroll down to read a little bit about prevention here, it's very important for the prevention. For example, they said an estimated 25% of epilepsy are potentially preventable. If you prevent head injuries, for example, if you get the maybe adequate prenatal care, reduce the new case of epilepsy, preventable epilepsy associated with a stroke, for example, and cardiovascular disease, the central nervous system infections. All these could be, if you manage this cases, we will prevent the individual from suffering from epilepsy. Okay, now moving to the category or like classification of seizures. We have two main type of seizure, as you can see here on the screen. The main type, the first main type, we have it here. We have the so as you can see here, seizure can be classified in two major group based on their origin in the brain. Could be focal in specific place in the brain, specific location. Could be focal, could be generalized seizure. Speaking about focal, we have simple partial seizure, then we have complex partial seizure. So we have two types of focal seizure: simple focal seizure, complex focal seizure. Regarding generalized seizure, we have absence seizure, tonic-clonic seizure, myoclonic seizure, atonic seizure, tonic seizure, and clonic seizure. Okay. Now we need to differentiate between these two types of seizures, and I will start with generalized seizure. The situation here, as you can see here from this, the situation, I will go the green color. In generalized seizure, the definition of generalized seizures, seizure in this situation, seizure affect both sides of the brain. So seizure affect both sides of the brain at the same time and cause loss of consciousness. So generalized seizure is associated with the generalized of losing consciousness. We have several types. We have absence seizure. It's like brief lapses of in awareness, often described like staring spells. Okay, so brief lapses in awarenesses and described are staring spells. Absence seizure. Tonic-clonic seizure, characterized by muscle rigidity. Okay, muscle rigidity followed by muscle contraction. So tonic-clonic, we have two things. The tonic-clonic, we have muscle rigidity followed by muscle contraction. Okay, so we call this one tonic followed by clonic. So we call this one tonic-clonic seizure. Myoclonic seizure, myoclonic, myo belong to the muscles. This is like brief jerks or twitches of muscles. Okay, myoclonic seizure. Atonic seizure, atonic mean no tone, no muscle, no power. So it's sudden loss of muscle tone leading to the collapse. Okay, so atonic seizure is sudden loss of muscle tone leading to the collapse. Tonic seizure, here the patient suffers from stiffness in the muscles, stiffness, contraction in the muscles. Clonic seizure, here we have rhythmic jerking movement of the muscles. Okay, moving to the focal seizure. Focal seizure affect initially only a portion of the brain and typically one part of the brain, one hemisphere of the brain. So if you talk about two hemisphere of the brain, this type of seizure affect one part of the brain. We call this one focal seizure. Could be one part, could be maybe one part of the brain here, or the entire part of the hemisphere. So normally affect only a portion, portion of the seizure. So here, if you clean this one here, for example, and make it big, this is a brain here, two parts. Okay, could be one part of the brain affected. Here, maybe the portion of brain typically in one hemisphere. We have focal seizure, focal aware seizure, simple partial seizure, awareness not affected. The patient here start aware, and then we have complex seizure, awareness will be impaired. So when you talk about simple seizure, is the affected not the awareness not affected. When we have complex seizure, the awareness will be affected or impaired. Okay, seizure can be viewed as a result of unbalance between inhibitory and excitatory process in the brain, leading to the either too little inhibition or too much excitation. So we have too much of excitation, or too little of inhibition. Okay, so seizure may be viewed as a result of imbalance between inhibitory and excitatory process. Okay, so we have two main neurons in the brain involved in epilepsy: glutamate neuron, then we have GABA neuron. Glutamate neuron responsible for excitatory. So glutamate neuron responsible for excitatory effect, and we have GABA neurons responsible for inhibitory effect. So we have two main neurons in the brain responsible for excitatory and inhibitory effect. The excitatory effect is GABA, responsible for excitatory effect, and GABA, so glutamate responsible for excitatory effect, and GABA responsible for inhibitory effect. Okay. So as you can see, the relationship between two neurons here, between GABA and glutamate. And here we have the neuron in the case of resting phase. And the negative charge will be inside, and the positive charge will be outside of the neurons. And then we need to remember we have ion channels. Okay, you see the ion channels here. Okay. Okay, so we have ion channel. We have two types of ion channels. As you can see, we have calcium channels. We have sodium channels. So again, we have calcium channel, allow calcium to enter the cell, and then we have sodium channel, allow calcium. And what we have here, before we move further, as you can see here, we have something called preganglionic neuron and postganglionic neurons. Okay, again, and this one here, as you can see, when the calcium enter the preganglionic neurons, sodium and calcium, these ions enter the neurons. This will bring more ions, more positive ion, as you can see here. More positive ions will bring more positive ion to inside the vesicles. This will lead to the maybe engulfing this vesicles. This vesicles here contain granules. This will be engulfed and release the content of glutamate. This vesicles contain the maybe the glutamate, okay, the mediator called glutamate. So when calcium and sodium enter the cell, this will shift the ions inside the neuron to the positive, and this will lead to the allow this vesicles to release the content in the synaptic cleft. So that this vesicle will release its content in the synaptic cleft. You can see it in the next. As you can see here, the vesicles release its content in the synaptic cleft. This is a synaptic cleft or gap junction. Okay, so releasing in the gap junction. So this is the next step now. So the first step, the ions, positive ion sodium and calcium enter the cell through the ion channels. Okay, ion channels, this will shift the ions to be positive inside the cell. Digging on the vesicles allow the vesicles to release content to the synaptic, to the GAP junction or synaptic cleft. Okay, now the glutamate is in the synaptic cleft. You can see the glutamate on the synaptic cleft here. Next step, okay, in the postganglionic neurons, you can see here in the postganglionic neurons, we have two type of channels. The first channel is called NMDA channels, and the second one AMPA channels. So what is that, the abbreviation mean? NMDA channel stands for N-methyl deaspartate. N-methyl deaspartate. AMPA channels stand for alpha amino 3 hydroxy 3 methyl 4 isozoliprovinic acid. It's not important to remember all these abbreviation meaning, but we need to remember the abbreviation only. It's not like explanation what that mean, but we need to remember that in the postsynaptic neurons we have two type of channels. NMDA channels responsible for allowing calcium to enter the cells, as you can see it here, and AMPA channels allowing sodium to enter the cells. So as you know that when sodium or calcium enter the cells, when sodium or calcium enter the cells, okay, one of these ions enter the cells, the result will be hyperpolarization. That means we are talking about stimulation. So when you stimulate the brain with a severe stimulation, for example, this will lead to the seizure. Okay, so this maybe explain what happened there. So glutamate release, activate that ion channels, allow sodium and calcium to enter the cells, and this will cause stimulation. So I will go to the next slide. So you can see here we have we don't have only the sodium and calcium. We have another maybe channels of calcium called T-type calcium channel available in the postsynaptic T-type calcium channels. Okay, T stands for transient, and we have HVA calcium channel in the presynaptic. In the preganglionic or presynaptic, HVA stands for high voltage gated channel, high voltage calcium channel. Then we have voltage gated sodium channel, VG, voltage gated sodium channel. So we have two type of calcium channels in this image here. Okay, this is the situation here. If you go back a little bit, we have stimulation here. As you can see here, we have stimulation to the neurons. When this happen, the postganglionic neuron will be stimulated and causing the stimulatory effect, or like convulsions, could be jerks, could be seizures, could be all these type of stimulation on the brain. Okay, but on the other hand, we have another neurons here. This neuron is the name GABA neurons and contain vesicles, and in this vesicles we have GABA here, and this GABA will interfere here to bring the balance to the normal, so that we have stimulatory neurons, GABA stimulatory neuron. On the other hand, we have glutamate stimulatory neurons. Then we have GABA inhibitory neurons. GABA will interfere in these steps here. So as you can see here, GABA release its content. The GABA vesicles release its content to the vesicles, bind to the GABA A receptor in the postganglionic neuron. This is GABA receptor in postganglionic neurons. So GABA will allow chloride to enter the cell, and we know that chloride has a negative charge. This will lead to the balance and bring a negative charge to inside the neurons and bring to the neuron to the balance situation. So you can see here by the GABA interference will bring the situation to the balance. So we have here balance between glutamate and GABA on the neuron in the central nervous system. Okay, what happened next? How this situation work? What do you have any more steps? Yes, we have another steps called like reuptake. So this is a GABA here in the synaptic left. You can see the GABA. Okay, in the green color, this is a GABA here. Okay, this is a GABA mediator. We have number one, bind and activate GABA A, allow chloride to enter the cell and cause case called like hyperpolarization. If I go back in order to be sure so here I need to correct myself. When sodium and calcium enter the cell, the situation will be depolarization, not hyperpolarization. Depolarization. I would like to correct myself here. So when sodium and calcium enter the cell, the situation will be depolarization and stimulate the neurons. The situation here, when the GABA release allow the chloride, activate chloride channel, allow chloride to enter the cell, the situation will be hyperpolarization and induce relaxation, induce inhibitory effect. So GABA induce inhibitory effect. What else? What do you have there? So if I clean this space here for ourselves here, what we have. So number one, they try to remind us we have several targets for GABA. Number one, GABA mediator will bind to the GABA A receptor, allow chloride to enter and bring the situation to the balance. Number one, this is number one. Number two, we have transporter called GABA GAT transporter, and you can see it here, GABA transporter type 1. GABA transporter type 1. This is responsible for something called reuptake. Okay, so GABA responsible for reuptake. This will maybe practice negative effect. I will go back. I don't know what happened. Practice negative effect on GABA postsynaptic. Next, we have another enzyme called transaminase, and this transaminase here responsible for metabolism of GABA. So now we have the situation here. Maybe we can go back and explain a little bit what happened. Okay, so speaking about GABA, number one, GABA will bind to the postsynaptic receptor, postsynaptic ganglionic, and we call this one GABA A receptor. Okay, this will lead to the open chloride channels, lead to the case of hyperpolarization or relaxation. Okay, could be hypnotic, could be anti-anxiety, whatever. So this one, number one, and this receptor here available in both synaptic. Please remember that. Then they said we have another case called reuptake. Now we call this one reuptake by GABA. CAT1. Okay, this is number one, CAT1. And then we have another enzyme in the GABA. We have GABA T transaminase. This one responsible for metabolism. So you can see here we have three fate for the GABA here. So if you like to enhance the action of GABA in this one here, we have two options. Option number one, for example, we can prescribe something to enhance release of GABA. So we try to enhance release of GABA, such as, for example, release of GABA or activate the receptor. So we try to enhance or activate the receptor. So, for example, we have diazepam. Activate the GABA receptor, and this is number one. Or we can use some medication to enhance this GABA. So this is number one, by activate the receptor. This receptor here will be activated by this medication. Another one, okay, they said we can inhibit the GABA transaminase enzyme. Okay, then or we can inhibit reuptake. So we have three maybe site for interaction. Number one, activate the receptor such as diazepam or phenobarbital, or inhibit transferase such as tiagabine, or like working on the GABA transporter. We have done with the target work here. I move again if you have any more. So here we need to remember all these components for the preganglionic neuron, postganglionic neuron, high voltage calcium channel in the presynaptic, voltage gated sodium channel in the presynaptic. We have glutamate. We have some target here for small protein physicals, SV2 physicals protein. We have another protein near to the calcium called alpha 2 delta 1 maybe target. So as you can see here, we have several targets for the anti-epileptic drugs. Okay, we start talking about okay, let us speak now. Let us speak medication. Let us speak about drugs used in epilepsy. How this medication work? What is the site of action of this medication? As you can see here, we need you to remember the maybe location and site of action. Number one, mechanism of action. We have phenytoin. Okay, phenytoin, carbamazepine, lamotrigine, topiramate, zonisamide. So this one block sodium channel. So what is the mechanism of action? Phenytoin, carbamazepine, lamotrigine, topiramate, zonisamide. The zonisamide is like block sodium channel in the preganglionic neurons. This is number one. Next. Okay. Next, and we have two important medication available, and this one of the most important popular medication now, and the new medication roughly available now in the pharmacy in the practice, levetiracetam Keppra. This medication inhibit the protein called SV2A protein on the glutamate vesicles. So the levetiracetam work on the protein called SV2A on the glutamate vesicles. Then we have gabapentin, pregabalin. Gabapentin and pregabalin, this inhibit alpha 2 delta 1 protein and the calcium channel. So gabalin and gabapentin, this type of medication, two medication work on the calcium channel, but on a specific site called alpha 2 delta 1 components. Okay, now we have three group of medication. The first group work on sodium channels. We have phenytoin, lamotrigine, carbamazepine, topiramate, zonisamide. Levetiracetam, SV2A on the glutamate vesicles. Gabapentin, pregabalin, alpha 2 delta 1 on the calcium channels. This one on the presynaptic. Next, okay, we have tiagabine. Tiagabine work on the transporter. If you go a little bit behind, so you can see here GAT1 transporter type 1. So tiagabine, if you like to remember, we have T stand for transporter, we have GABA. So tiagabine work on the transporter of GABA transporter. So tiagabine inhibit GABA transporter. And then we have fulbamate inhibit NMDA, fulbamate. Okay. Figabatrine inhibit transaminase, GABA transaminase, figabatrine. We have GABA, figabatrine. Figabatrine inhibit the GABA transaminase, inhibit the enzyme figabatrine, inhibit GABA enzyme, GABA T transaminase. Okay, then if you move to the next one here, next group of medication, we have some medication work on GABA receptor and the ganglionic neurons. We have phenobarbital, benzodiazepine, topiramate, zinazomide. Again, which of the following medication activate? Which of the following medication? This is not a minus here. Should be this one. Should be plus. Well, not minus. Activate. Okay, which of these this medication activate GABA receptor? Phenobarbital, benzodiazepine, topiramate, zinazomide. Okay, activate GABA. A, allow chloride to enter the cell. Last group for the anti-epilepsy or anti-epileptic drugs, we have medication block sodium channel. Medication block sodium channels. With the X here mean block sodium channels. We have ethosuximide, topiramate, valproic acid, zinazomide. So again, which of the following medication inhibit T-type calcium channels? So the most important one, we need to remember the most important one, ethosuximide. The most followed by topiramate, valproic acid, zinazomide. Ethosuximide, the most popular one, and need to be remembered because used mainly drug of choice for absence seizure, ethosuximide, followed by topiramate, valproic acid, zinazomide. If you look on the highlight, the yellow highlight, for example, topiramate, you can see topiramate here. You can see topiramate also here, another one here. So we have topiramate in 4 places. What that mean? Someone may say topiramate has broad spectrum of action. Do you agree with this one? Topiramate has broad spectrum of action. Work on several places on the brain. Topiramate, Topamax. So topiramate block sodium channel. Topiramate block AMPA. Topiramate block calcium channel. Topiramate activate GABA. For this reason, topiramate could be used for all type of epilepsy. The same will be applied for zinazomide. We have it in three places also. The same will be applied. Okay, as you can see here from this references and citation, for example, here we have topiramate, zinazomide, felbamate. I will click on one of them at least, and then we can review the rest at your own time. Okay, if you click on the topiramate, okay, so we have topiramate now. Okay, we have the topiramate. This is the epilepsy here from the prevention WHO. You can read this is 71 pages from topiramate. If you make it big here, you can see the information. Topiramate, Topimax is tablet for oral use. So you can see the indication for topiramate could be used for epilepsy, initial immunotherapy for patient more than 2 years old, adjunct therapy for epilepsy, so could be used for like partial seizure, or for generalized seizure. So we use it for both. We can use topiramate for migraine. This is great. We need to remember that. Also topiramate, they found that topiramate associated with the decreased weight. Okay. Okay, so I will speaking about mechanism of actions. Maybe we can look on mechanism of actions in order to maybe share with you. Okay. Okay. This is a mechanism of action. As you can see here, they said this, the precise mechanism in which topiramate exerts its anticonvulsant migraine prophylaxis are unknown. However, the preclinical study found that 4 properties that may contribute, four mechanisms of action, 4 actions for topiramate electrophysiology. What they found here, number 1, blocking sodium channel. So we have it. Number one, blocking sodium channel. Okay, this will lead to the activation, and number two will activate GABA receptor. Number two. Number three, antagonize the AMPA receptor. And final one, inhibit carbonic anhydrase, particularly isoenzyme 4, 2 and 4. So we have four mechanisms may be involved in the action of topiramate. So I recommend, for example, recommend you to go through this link here and read the information. Okay, this concludes our first part about anti-epileptic drugs, which include definition and the classification of anti-epileptic or anti-seizure drugs. And in the next session, we are going to speak about individuals' medications such as phenytoin, carbamazepine, valproic acid, and escitalopram, and ethosuximide, topiramate, and each medication on individual basis. Thank you so much, and see you then.